The Michigan Public Health Training Center welcomes you to this module, Financing Public Health. As we learned in the previous module, resource stewardship is a key function of public health governance. In this module, we will explore the role of boards of health as stewards of public health resources. We will also identify the importance of funding for boards of health and for public health in general. Finally, we will discuss various sources of funding and the best way to access them. Let's start by looking at the role of boards of health as stewards of public health resources. It is important to understand how boards of health can support public health agencies in the best use of the available resources. What does it mean to be a steward? In this context, it means not only being knowledgeable about your health department's budget, but also ongoing engagement with your local health official. It means taking into account what the leadership hopes to accomplish and ensuring sufficient funds to address priority issues. According to the National Association of Local Boards of Health, or NALBO, resource stewardship is assuring the availability of adequate resources to perform essential public health services. Developing and approving a budget that meets the needs of the community and the requirements of the health department includes long-range fiscal planning. Sometimes budgets require maintenance of effort for state dollars, cost sharing from the general fund, or spending in accordance with grant requirements or restrictions. Budgeting may also involve revenue generation. If applicable, the Board of Health must make sure that fees for services are in alignment with other jurisdictions and are fair and reasonable considering the populations being served. Ultimately, it is important to remember that the Board of Health has been entrusted with funds to support the community and must take care when using those funds. In addition to budgeting, NALBO suggests that key components of resource stewardship for boards of health may include ensuring that adequate facilities and legal resources are available to support public health in the community. It may also mean developing agreements with neighboring governing entities to share resources. Several states have guidebooks available for local boards of health that illustrate their role as resource stewards. For example, the Indiana Local Boards of Health Orientation Manual outlines the board's role in setting conditions and standards for all funds solicited in the health department's name, engaging in sound, long-range financial planning, approving budgets, and establishing policies and procedures for financial spending. Check with your state health department or state association of local boards of health for a similar guidebook available for local boards of health in your state. With this understanding of the roles of boards of health as resource stewards, let's look at ways that boards of health may support health departments in securing adequate financial resources to best perform their essential services. Sufficient funding allows public health agencies to promote information pertaining to new policies and to disseminate best practices. It also allows them to collaborate with other organizations on programs to improve population health. Before describing the role of boards of health in financing such programs, let's explore public health financing in general. State health departments receive their funds from multiple sources, with variation from state to state in the proportion of funding received from a given source. As you see on the screen now, state health departments generally receive about 50% of their funding from the federal government. This tends to come in the form of grants, cooperative agreements, contracts, and allocations. About 24% of state public health funds come from state taxes, and the rest may come from fees, Medicaid and Medicare, or other revenue. Local health department funding is funneled from state and federal sources through state agencies. Local jurisdictions also provide funding for programs. If the local agency is a unit of a larger state agency, funding from the area served plays a smaller role. Local health departments and their boards of health may also depend on funding from private grants and foundations, collaborative and project-specific grants, and jurisdiction-based funding. Federal funds for state and local public health agencies typically come from the U.S. Department of Health and Human Services and its agencies such as those listed here. Let's look at Ohio as an example of public health funding. In Ohio, governmental public health is supported by a combination of federal, state, and local funding sources. In fiscal year 2012, 70% of the Ohio Department of Health's funding came from federal sources, with the remaining funds coming from the state. 65% of the federal funds were passed on to local health departments, businesses, and other organizations or programs like WIC or Children with Medical Handicaps. About 75% of local health department funding in Ohio comes from local sources, such as local government, general revenue and mileage, or local fees, and contracts to provide environmental health services. Let's look at how Illinois established funding for local health services. In Illinois, health departments and their governing boards of health can be established at the city level, county level, and also at a bi-county or multi-county level. Local boards of health have different options for providing funding to local health departments, such as county's general fund or tax revenue. It is important to note that in Illinois, while it does not matter what method is used to provide local support, the Board of Health reports to the appropriate governing board, which has full budgetary approval authority. Unfortunately, the public health system has been chronically underfunded for decades. Expert analysis have found that limited public health funding has severely impacted the ability for federal, state, and local entities to adequately carry out many core functions, including programs to prevent disease and prepare for health emergencies. A study conducted by Dr. Glenn Mays at the University of Kentucky in 2013 illustrates the importance of adequate funding for population health. Dr. Mays found that increases in public health spending are associated with decreases in infant mortality and non-infant deaths from cardiovascular disease, diabetes, cancer, and influenza. These improved health outcomes were seen in communities that targeted spending on low-income areas, or that allocated their public health funding across a wider range of preventative services. In an article by the Robert Wood Johnson Foundation, Dr. Mays suggests that the results clearly show that better health and lower healthcare costs are possible if we simply change how and where we allocate public health funding, even if new money isn't available. He continues on to say, it also shows that new resources such as funding from the Affordable Care Act's Prevention Fund can have a larger impact if targeted to lower resource, higher need communities, and if spread across a range of prevention strategies. A Board of Health can play an active role in obtaining and making decisions about how to allocate funds within their jurisdiction to best support population health outcomes. While it is health departments that usually apply for grants, a Board of Health can also be a grant seeker. Additionally, a Board of Health may be asked to support, review, or provide oversight for the local health department's grant application. Boards of Health can and should be involved in discussions when health departments seek funding from outside resources, as they can provide necessary letters of support, convene funders, or make connections between partners to support a program. If you are writing or reviewing a grant proposal, please see the resources section for a few grant writing resources. Boards of Health can help their state or local health department make the best argument for obtaining funding by supporting them and emphasizing several key elements in their proposals. Healthy People 2020, a program of the U.S. Department of Health and Human Services, outlines several steps for locating sources for and securing funding. The first step to acquiring funding is to get the necessary data to demonstrate a need for financial and programmatic resources. Use data sources like the County Health Rankings and Roadmaps or the CDC's Behavioral Risk Factor Surveillance System. You might also become familiar with other local surveillance resources to find specific information about your community. Next, see how your city or state compares to national baseline data using a data source like Healthy People 2020. The second step when considering funding opportunities is to align your local health goals with national initiatives. For example, if you are interested in obesity-related funding opportunities, you could tie your local efforts to national obesity campaigns conducted by organizations like the Centers for Disease Control and Prevention or the American Heart Association. It is also important to identify new stakeholders and partners by making connections with experts in other communities and states. Finally, use evidence-based information to plan a strong public health program. This will ensure the best possible use of limited resources by focusing on implementing strategies that have been proven to work to promote health. There are federal, state, foundation, and national association sources of funding for public health. Let's look at a few of those sources. Grants.gov is a centralized location for grant seekers to find and apply for federal funding opportunities. The site provides access to 26 federal grant-making agencies, such as those shown here. You can learn more by going to www.grants.gov. In addition to federal funding, each state may also have funding opportunities available. For example, Hawaii, which ranked first in the nation for per capita public health state funding in 2012, awards grant funds to nonprofit organizations to support health-related programs. The Minnesota Department of Health provides grants and loans to eligible applicants, including, but not limited to, community-based organizations, community health boards, hospitals, school districts, local public health, and tribes. A July 2014 example of a state-funded opportunity was the Comprehensive Supportive Services for Safe Harbor, No Wrong Door, in which applicants provide support services to sexually exploited youth. You should visit your state health department's website to discover what funding opportunities are available. There are many foundations that have funding focused on national, regional, or local initiatives. The Robert Wood Johnson Foundation is just one example of foundation funding, and it provides grants for projects that advance the foundation's mission to improve the health and healthcare of all Americans. The foundation has also provided grants to advance accreditation and support quality improvement in local health departments. In general, organizations eligible for Robert Wood Johnson Foundation grants are public agencies, universities, and 501c3 public charities. You can learn more by going to www.rwjf.org/grants. There are also many national associations that offer public health funding opportunities. One example is the National Association of County and City Health Officials, or NACCHO. NACCHO funds local public health initiatives and provides a list of funding opportunities on their website. An example from August 2014 was NACCHO's funding opportunities for health impact assessment, which provided approximately 3 awards of up to $15,000 each to local health departments to complete a health impact assessment. You can learn more by going to www.naccho.org/topics/funding. Now that we have explored all of the module objectives, let's look at an example of what an effective Board of Health can do for its community as a resource steward. The following example is just one of many possible examples from various settings across the country of a Board of Health success. Franklin County Public Health in Ohio is the 6th largest health district in the state, serving more than 430,000 people in 17 townships, 14 cities, and 9 villages. The health district is governed by the Franklin County Board of Health, a 5-member board appointed by the District Advisory Council. The health department provides public health services, plumbing inspection, and enforcement of public health regulation to the Franklin County townships, cities, and villages, each of which pays the health department for those services. The Board of Health is responsible for setting and approving the health department's budget. This includes approving any rate increases the health department charges for the services it provides. In 2011 and 2012, there were no increases in the per capita rate. In 2013 and 2014, the board approved a 3% increase for services provided, which was a per capita rate of $6.11. The Board of Health approved a per capita increase of $2, almost a 33% increase, in its August 12, 2014 meeting. By negotiating and approving increases in per capita rates to support the health department's budget and activities, the Board of Health is acting as a resource steward and ensuring resources are available to meet the community's needs. You have now completed this module, Financing Public Health, in which you explore the role of boards of health as stewards of public health resources. You then discover the importance of funding for boards of health and for public health in general. Finally, you learned about various sources of funding and the best way to access them. Please continue on to the next video in the series. This training is provided by the Michigan Public Health Training Center at the University of Michigan School of Public Health, Office of Public Health Practice. Funding for this project was made possible by the Health Resources and Services Administration Bureau of Health Workforce. This training was developed in collaboration with the Michigan Public Health Institute.